Hi guys, welcome to Mastermed Academy. If you are new to my channel, please press the subscribe button and hit the bell icon to receive future updates on our new and awesome upcoming videos. And don't forget to follow us on Instagram. Today I'm going to be talking about hypersensitivity reaction. Now, what is a hypersensitivity reaction? Now, hypersensitivity reactions are basically just an exaggeration of an immune response. So what do I mean by an exaggeration? Now, hypersensitivity reactions are just a normal immune response, but the problem is that they are just over expressing themselves, meaning they are expressing themselves so much that it causes damage to our own body, right? And we have many examples of hypersensitivity reactions, so I'll be going through each of them. But let's see what the definition is. Now, hypersensitivity reactions are immune responses that are exaggerated or are inappropriate against an antigen or allergen. They are basically an undesirable reaction produced by the normal immune system, including allergies and autoimmunity. So the exaggeration could be an allergy or autoimmunity. They are usually referred to as overreaction of the immune system, and these reactions may be damaging, they may be uncomfortable, and occasionally fatal. Hypersensitivity reactions require a pre-sensitized, very important, pre-sensitized state of the host. Now we have 4 types of hypersensitivity reaction. Now I'm going to go through each and every one of them. So let's start with type 1 hypersensitivity reaction. Now type 1 hypersensitivity reaction is consisting of anaphylactic reaction, which is a systemic reaction, and atopic reaction, which is a local reaction, which mainly involves skin. Now we have 2 types of reaction. We have an immediate reaction and we have a late reaction. Both of them are belonging to type 1. Now the main difference between the immediate and the late reaction is the timeline. The immediate reaction occurs within minutes. So this is high yield. That's why I put the minutes in red font. While the late reaction, it occurs in hours. Now, in immediate reaction, we have antigen crosslinks with IgE, which is present on the mast cell, that leads to degranulation and release of vasoactive amine called histamine. Now the histamine, you have to just remember two basic functions. One, it causes bronchoconstriction by constricting the smooth muscles in the bronchioles, and the second is vasodilation. So that's why the next point says that the smooth muscle contractions are seen in bronchioles, and tryptase is a marker of mast cell activation. Now in late reaction, chemokines and cytokines are secreted from a mast cell, which mediate the tissue damage and inflammation. So I hope you understood immediate and late reactions. Now this is a cartoon showing the mechanism of type 1 hypersensitivity. Now as we can see, the gray cell here is the mast cell or a basophil. Both belong to a same precursor. Both are different cells, but the thing to remember is they both belong to a same precursor. Now the mast cell has Fc receptor for IgE antibody. Now as soon as the IgE antibody binds to the Fc receptor of the mast cell, right, and if it sees a nearby antigen, right, it binds to the antigen. So the IgE antibody which was present on the mast cell will bind the antigen, and as soon as the binding take place, there will be a release of histamine and histamine like substances, as well as eosinophilic chemotactic factor. Now both of them will lead to an anaphylactic reaction. It might lead to a urticaria. Urticaria is basically a skin reaction or a skin rash. Basically it's a skin rash. And the third, bronchospasm. So these are the 3 things that we could expect once a mast cell is degranulated. So anaphylaxis can be caused due to asthma, peanut allergy, bee sting, allergic conjunctivitis, and seasonal allergies. Now the test that we can use is basically a skin test, or we can use a blood test, ELISA, for allergen specific IgE. Now in a summary, I would like to say that in type 1 hypersensitivity reaction, you have to remember about the mast cells, you have to remember about the IgE, you have to also remember how they interact and what is the resulting substance that is secreted. So I hope you guys understood type 1 hypersensitivity reaction. Now these are the effects on the body due to anaphylaxis. And you could have dizziness, you can have itchy mouth, you could have difficulty in breathing, and there are so many symptoms. So I hope you understood the anaphylaxis. Now, type 2 hypersensitivity. Type 2 hypersensitivity is basically a cell surface antigen antibody complex. If you want me to just tell you one word about type 2 hypersensitivity, it's that there is an antigen antibody complex, and that complex will deposit in tissues, which would lead to inflammation or cellular destruction or cellular dysfunction. Now, what is the inflammation? What is the cellular destruction? I'm going to go through them. Now, antigen antibody complex, when they deposit in a tissue, they can cause cellular destruction. Now, opsonization of cells by bodies lead to phagocytosis, which is basically engulfing the pathogen by a macrophage. We have natural killer cell killing through a process called ADCC, antibody dependent cellular cytotoxicity. And also the antibodies can activate the complement system. Now, what are the examples? Autoimmune hemolytic anemia, idiopathic immune thrombocytopenia, and hemolytic disease of the newborn. Now, in hemolytic disease of the newborn, there is a transfer of maternal IgG through the placenta into the fetus, and that IgG basically reacts towards the antigens present on fetal RBC. That leads to the hemolysis of RBC, and that leads to the process called erythroblastosis fetalis. Hemolytic disease of the newborn can also be called erythroblastosis fetalis. They are synonyms. And then also in transfusion reaction, we have hypersensitivity type 2 reaction. Now, this is a cartoon showing the natural killer cell here, and it is basically attaching itself to the antibody that is present or that is coating the target cell. Also, the antibody can also coat the target cell and attract complements, which may lead to complement mediated lysis. So I hope you understood this cartoon. The next is inflammation. Now, what kind of inflammatory diseases can happen here? Now, the examples basically are Goodpasture syndrome. This is a disease which is affecting both lungs and kidneys. This is an autoimmune disease. Next is a rheumatic fever. So a long-standing non-treated streptococcal throat infections can lead to rheumatic fever. And the last is a hyperacute transplant rejection. So now in inflammation, usually we have an activation of the complement and FC receptor mediated inflammation. So because of this, there is neutrophilic attraction towards the site where the antigen antibody complexes are deposited. So this is how the inflammation is also a part of type 2 hypersensitivity reaction. Now the next is cellular dysfunction. Here we have antibodies that bind to cell surface receptor, leading to blockade of cellular processes. For example, myasthenia gravis. This is an autoimmune disease where we have antibodies against nicotinic acetylcholine receptors. So either they are destroyed by the antibodies or they block the antibody, so that there is muscle weakness. So myasthenia gravis. Then there is a Graves' disease, which is a hyperthyroidism, where we have antibodies against the thyroid stimulating receptor in the thyroid gland. Then the third is the pemphigus vulgaris, which is a skin disease basically. So I hope from these examples you are clear what diseases belong to type 2 hypersensitivity reaction. So again, to summarize, one word to remember: in type 2 hypersensitivity reaction, we have antigen antibody complex that is being deposited in tissues, causing damage. Next is type 3 hypersensitivity reaction, and here you have to remember three words together: antigen antibody complement. Now this whole is a complex, right? Now mostly IgG activate complement, attracting neutrophils. Now the examples that include are polyarteritis nodosa. This is a type of vasculitis. Vasculitis means inflammation of a vessel. SLE is lupus, and PSGN stands for post-streptococcal glomerulonephritis. And the last is rheumatoid arthritis. It is due to the rheumatic factor. So these are the examples that you should be aware of regarding type 3 hypersensitivity. Now, This is a cartoon that shows how a type 3 hypersensitivity is carried out. So you see, in the first step, we have an immune complex that is deposited in the wall of the blood vessel. Now, as soon as the immune complex is deposited, the immune complex activates the complement and it will attract inflammatory cells such as neutrophils. So once neutrophils are attracted and they reach the site where the complex is deposited, we have release of enzymes from neutrophils that cause damage to the endothelial cells of basement membrane. So I hope you understood this cartoon. Now, the classic triad that you should be aware of regarding type 3 hypersensitivity is fever, urticaria, and arthralgia. Arthralgia stands for painful joint, while arthritis stands for inflammation of the joint. So here we have fever, urticaria, and arthralgia. We also have sometimes proteinuria and lymphadenopathy, which occur 1 to 2 weeks after the antigen exposure. So the first type of reaction in type 3 hypersensitivity is serum sickness reaction. Here we have a reaction to foreign proteins by producing antibodies. Now, 1 to 2 weeks later, the antigen antibody complex forms and they deposit in the tissues. Complement activates, leading to inflammation and tissue damage. And serum sickness like reaction are associated with drugs like penicillin, which is a hapten. Hapten basically stands for a molecule that binds the penicillin, and because of that binding, the immune system attacks the penicillin molecule. So this is a hapten. So either it could be due to hapten or it could be due to an infection, especially hepatitis B. The second is the Arthas reaction, and in Arthas reaction, it's a local subacute immune complex mediated hypersensitivity reaction, right? Serum sickness was systemic. This is a local. Arthas reaction appears 4 to 10 hours after injection, in contrast with type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction was in minutes, while the Arthas reaction takes 4 to 10 hours to come. So the timeline is the difference. Intradermal injection of antigen into a pre-sensitized individual. Pre-sensitized means that the patient already has IgG antibodies against that specific antigen. So when you give an intradermal injection of the antigen, the individual will have an immune reaction, and that would lead to the immune complex deposition in the skin where you put the intradermal injection. So at the site of the injection, you'll have the immune complex deposition that would lead to inflammation and other kinds of immune response. The reaction is characterized by edema, necrosis, and activation of complement. Now the examples are reported with skin infections such as tetanus, diphtheria, hepatitis B, vaccine, and insulin. Hypersensitivity pneumonitis is also called the farmer's lung, and this is h.s.r. towards environmental antigen. Now the last is type 4 hypersensitivity reaction. This hypersensitivity reaction does not involve antibodies. This is the first point you should be aware of and have to remember for life. This reaction does not involve antibodies, unlike type 1, type 2, and type 3. It rather involves T cells, and there are two mechanisms to it. One is direct cell cytotoxicity and the other is inflammatory reaction. Now what is this direct cell cytotoxicity? This is mediated by CD8 positive killer T cells. So they kill virus targeted cells, while in inflammatory reaction we have CD4 T cells that recognize the antigens and release inflammatory cytokines. Now let's go to the whiteboard and let me explain you how the inflammatory reaction takes place. Now let's imagine that this red star is an antigen, and the blue cell here that I'm drawing is a dendritic cell with a big mouth. Now dendritic cells are also known as APCs, which means antigen presenting cells. And let's imagine that this dendritic cell is now happy and it ate up the antigen, and now it's presenting the antigen on its receptor. Now the DC cells are going to present the antigen to this brown looking cell with eyes, a nose, and a receptor, and also it has ears with spiky hairs, and this cell is known as a T helper cell. Now as soon as the T helper cell recognizes the antigen presented by the dendritic cells, it gets sensitized, and this phase is known as sensitization phase. So I hope you guys understood this. Now the same T helper cell gets activated, and it has more spiky hairs now all over its face, and the activated T helper cell basically will activate a nearby macrophage, right? And this purple cell is a macrophage cell. Now it is very angry because it knows that okay, we have a foreign antigen, and the T helper cell is giving the macrophage a command to secrete inflammatory cytokines. So this activated macrophage, which is so happy because it received the signal from the T helper cell, is gonna secrete cytokines like interleukin 1, interleukin 6, tumor necrotic factor alpha, interleukin 8, and interleukin 12. And this phase is known as the effector phase. And the interleukins that I presented here are inflammatory cytokines. So let's come back and see what I say in the text. So I say that type 4 hypersensitivity reaction includes direct cell cytotoxicity and inflammatory reaction. The examples include tuberculin skin test, which is PPD. Intradermal injection with antigenic extract of Mycobacterium tuberculosis is given to the patient. Now, induration means skin thickness, right? So skin thickness and redness of the skin or erythema peaks 1 to 2 days. That results from inflammatory response induced by sensitized T cells. So when we do a PPD test, and let's imagine that there is a patient and he is pre-sensitized, or he was exposed to TB before sometime in his life. So when we do a PPD test, when we give him the injection with the antigenic extract of the tuberculosis, then what happens is the pre-sensitized T cells that are floating in his skin nearby, they recognize that antigen and then they produce an induration and erythema. So that is why after 1 or 2 days, we see the induration and erythema and we measure the thickness. So because it takes 1 to 2 days to show the induration and erythema, that is why we call this delayed type hypersensitivity reaction. Now the skin lesion is initiated by the Langerhans cell presentation of antigen to the previously synthesized TDTH cells, right? Now this is the same thing that I showed you in the diagram. Now we have the sensitization phase where we have the antigen presenting cell interacting with the T helper cell, and then T helper 1 cell will in the effector phase activate the macrophages. That leads to secretion of pro-inflammatory cytokines. So the last slide here says that contact dermatitis also belongs to type 4 hypersensitivity, and here the most common example to know is poison ivy, and the second most common is nickel allergy. So when you come in contact with poison ivy, usually the CD8 T cells, they interact with it and then they cause the reaction, the immune response. And to basically test this phenomenon, we use the patch test. The next is the graft versus host disease, and I'll talk about this in transplantology, and I'll explain you in brief what does this disease mean. And the last is the candida extract. So when you put the candida extract in a patient, the T cell immune function is responsible for producing the immune response, right? Now this is a picture of a 3-year-old child, a 3-year-old girl that came in contact with the poison ivy, and you can see that this is the reaction here because of the immune response. Actually, this is the immune response that you can clearly see. You can see the bubbles in the skin. So this is due to, this is a type of contact dermatitis. So I hope you guys enjoyed this video as much as I did, and don't forget to hit the like button, and if you're new to my channel, please hit the subscribe button and press the bell icon to receive future updates on our awesome videos on Mastermed Academy. Thank you for your attention, and if you do have any questions, please write them in the comments and I'll try to answer them as soon as possible. Thank you so much for your attention again. Goodbye.